and today's an interesting video similar to the last one I did about the scapula. Today I wanted to use some anatomy videos to show you what it looks like from a skeletal sort of vision of what goes on with all the different movements that the hips make, and why hip mobility and glute strength, like apart from being important, why it's so difficult to achieve. Alright, so let's have a look at how all this sort of ties in. Alright, so the hips, they're designed to be very mobile, and they have to withstand a lot of stresses and a lot of rotational forces, so it's very similar to the shoulder. Because of this, it's very vulnerable to injuries in these movements, because there's so many pivoting and twisting and hinging directions that the joint makes. Alright, so the muscles around the hip joint have to attach directly onto the hip capsule, and therefore they have a large influence on the range of movement that you might have. So you can see, like, probably the biggest difference between the shoulder is that there's no scapula. Also the muscle sizes are significantly greater, so they're much stronger and much more powerful, so they're probably more prone to stiffness than trigger points that you would see more around the shoulder. But very similar in that it has a lot of different things that can influence what goes on. Alright, so there's two potential problems that usually come across: restricted range of motions. So this type of problem can cause dysfunction in the lower back, especially the sacroiliac joint. But even so, the knee, as the result, these structures, like attempting to compensate for so basically your knee's going to be forced to find the excessive range of motion that the hip should have provided. Now the big question is, why did the hip stiffen up? It could be for a lot of reasons: overuse, inactivity, but usually weakness that sort of ends up creating the stiffness. So that's why I put here, it's more common in non-sporting people, so who sit too often, so sort of leaving the hip stuck in flexion, so they end up losing extension, which then becomes a problem for sacroiliac problems and extensors of the back, and also the knee being vulnerable because the glutes are unable to do their work. Alright, so that'd be the first problem I see. And the second problem is probably when you have too much hip movement, and basically you have a lack of control. So this would be like hypermobile people, or people doing too much yoga, too much stretching, or maybe incorrectly stretching. So this type of person tends to get clicking and clunking and feeling of weakness in the region. So this would be more common. If the first one's probably more common with back pain, this one would be more common with knee pain. So I tend to see this more so with ACL injuries in the knee, sometimes piriformis syndrome, so from ballet and things like that, dancers, getting a lot of, they're just so flexible that they really can't control the hip joint. With this one, inactivity, and people who probably don't stretch too much or stretch poorly, maybe too much strength work and neglecting their mobility. This person, too much mobility, neglecting their strength work. Alright, so you can sort of end up in the same place for two different reasons. Alright, so hip extension, if we look at the different movements that the hip can provide, so hip extension is an interesting one because it's sort of pictured here in two different types of hip extension. So this would be like when I'm bending, like a hip hinging hip extension, and this would be like my leg extending back behind me, as in sprinting with hip extension. These are both called hip extensions. So and as I've listed here, they're vital for like just everyday movements. So walking, running, because it helps propel the body forward and stabilize the pelvis, but it's also necessary for just bending over. So it's called a deadlift, but really that's just called bending over. So if you can't do hip extension, you're in you can see you're going to be in a world of pain, especially through the back, because the back's going to be the one thing that compensates around this. Alright, so let's have a quick look at how this works in an anatomy, so having a look at these in more in depth, what skeletally they look like. Okay, so here's the biomechanics of the hip extension, and you can see here this is sort of mimicking a running action. You can see there's a fair bit of knee flexion, but if you look carefully, you can see how the hip joint itself having to tilt forward, and this anterior tilt to guide that femur into position. Now, if this was stiff and immobile and not able to do so, either that femur is going to be pushed forward, which is your beginning of your hip impingence, or you're most likely going to develop problems in the spine where it's going to try to develop the hip extension. And thirdly, you're really probably going to have a limited hip extension, meaning you're going to have weaker glutes, not be able to move very fast, and just sets off a cascade of problems. All right, so this sort of gives you an idea of how important the hip joint is to guiding things in the right position. All right, so let's have a look. Okay, so that's that hip extension. So let's look at hip rotation. So the hip joint enables the femur to both rotate internally and externally. So femur is your thigh bone, in case you're not sure. So internal rotation occurs when the femur turns inward and the body towards the midline, drawing the knee and foot inward. So as you could see there, that's hip internal rotation, right? So the medial rotation, the hip brings the tips of the toes to face inward. So the range of internal rotation is typically more limited compared to the external rotation, as that depends on the flexibility of the surrounding muscles and the ligaments. So this is really important for tennis to provide, well, not just tennis but everyday movement, but it provides our power to rotate and do things. So that the hip's very important in this process. Otherwise, if we don't use the hips, we end up using the back, and that's when you get into some really nasty injuries like disc tears and really, fascia joint sprains, all types of stuff. All right, so really, really bad when that happens. So let's have a look at the hip rotation from a closer perspective. So now we have internal and external rotation. So you'll see clearly here how much further you can move in external rotation versus the internal. All right, so here's your internal. It's quite limited, and most people are limited anyway. The external has a lot more motion through it. You can see clearly how it's moving in and out with the femur moving inwards. Now, if I'm stuck through here, I'm going to be asking the knee to do this, which really it's not designed for that. And that's often where you'll see the dreaded ACL tears and the horrible knee injuries that occur. And a lot of it has to do with this, which is kind of what we saw with the pictures before with the tennis player. All right, so so I hope that gives you a good idea of what some of the things are. There's tons of movements the hips can make. These are just some of the main ones. I just wanted to give you a good visual of what it looked like so you can get that feel for it. Okay, so then we've also now have hip abduction and adduction. So abduction is when you're moving basically the legs being moved away. So from here, if it's when the legs are there and then they're moving out. Right, adduction is when the legs moving back inward. All right, so it's important to note during abduction the pelvis starts to tilt after the first 30 degrees. So while a person can theoretically abduct only one hip, in reality abduction at one hip causes a similar degree of movement at the other. So this is where, like, you see this leg moving, but really this leg is actually doing the same thing. All right, even though it's not moving because it has to oppose that. All right, and this is where again where the glutes become really, really important in this, because if they can't control it, then you get a collapse inward of the knee. All right, and again that's where we see the ACL injuries and things like that commonly affected. Also probably lateral pelvic tilt comes a lot into this one. All right, so let's take a look at this in a closer view. Here's where we have hip abduction, so abduction, and then you'll see it quickly followed up by the adduction, so where everything's coming back to the midline, so when it goes away from the midline and when it comes back to the midline. And you can see how much movement the hip has to make here, how much it is important to guiding the lower limb into positions, and also the other side, how important it is for it to be stable, and it's actually also moving as well. So you see it's not like it's not moving, this side is moving while that side's moving. So you can see how important these movements are and how unique they are in that you need to be stable and mobile at the same time, which is quite unique to the hip joint, which we've discussed several times. And also, like here, if you have a stiffness from inactivity or poor movement or just not looking after the hip joint, how much it can really compromise other things. So they'll start to collapse or try to compensate for the lost range of motion. All right, so what does all that mean? So basically it means the hip joints is quite a very interesting area of the body, because it can be both immobile and unstable. So meaning it's stiff but got too much movement, so it sort of contradicts itself. So, and as I've mentioned a few times, results in knee pain from the instability. Weak hip will allow too much internal rotation and adduction of the femur, or back pain from the immobility. So it's like, how can a joint be both immobile and unstable? Is quite an interesting thing to see. So my theories on this is usually that first it develops stiffness from inactivity or ignorance of looking after it. So usually from sitting too much or repetitive actions that are constantly shortening parts of the body, which then further inhibit other parts of the body that oppose that. They become extremely weak and are no longer able to perform those actions, such as hip extension, and eventually the weakness leads to compensation and then further instability. All right, so then obviously pain ends up usually at that point. All right, so weakness of the hip in either flexion or extension causes compensatory action at the lumbar spine, while weakness in abduction, or more accurately prevention of abduction, causes stress at the knee. So both problems are ongoing for the hip itself. So if you leave it, like, you could end up with back pain or knee pain, but you'll also inevitably end up with problems at the hip itself. So this is where you see the arthritis of the hip and ending up with the hip replacement through the ignorance of looking after it. Usually the weakness is the end result of causing this, where stiffness was the beginning of it, warning you of a weakness that you need to address. All right. So one thing that you can't ignore with the hip is the role of the feet. So the feet can actually be a big part of this, that may not present with any stiffness or pain at any point, but definitely can be a huge part of it. So in order, like, for example, to walk effectively and efficiently, you have to have a very good function of the big toe. So you need at least 65 degrees of big toe flexion, which activates the calves, hamstrings, and most importantly the glutes. So if you don't have enough big toe function, mobility, then you're really going to be using the muscles at the front of the leg to pull you forward, rather than the muscles at the back of the leg to push you forward. So this would be an example of you being unable to do that, because that big toe can't flex enough. You're going to be pointing the toes outwards, which is going to be creating issues at the hip. So the hip itself may have been perfectly fine, but now because of this big toe problem, it's not going to be fine. It's going to be compromised, and it's going to be put in positions it never wanted to be because of the foot. Also, second to that is when it's landing and it can't control the decelerate the body, because it's an unstable and weak foot. It's going to collapse inward, which is then where you see the problems in the knee, and all of that leads up into the hip. All right, so the feet are a big part of it. Another big thing that's often, which is weird, because it's when actually people are trying to do things to help the hip, end up overdoing it and doing the exact opposite. So an example of a hip flexor stretch, this type of stretch is terrible. All right, this girl might be able to do this all right, but constantly doing this type of stretch, especially if you're not mobile enough and doing too much yoga, is going to be pushing that femoral head forward and upward out of the socket. So it should be centered as seen here, but instead it's going to be pushed forward. This is where you lead into the hip impingements, or piriformis syndrome, or SIJ dysfunction. So all of these things lead to huge problems. So where this is a much more neutral position, where it's going to be centered, and you're still just releasing the front but not trying to crank it open, this just creates tons of trouble, and really is no good. So really, instead of stretching the real hip flexors, being the TFL and rectus femoris, end up overstretching your psoas, which leads to an unstable pelvis. All right, so second thing would be the opposite of that, trying to strengthen it, and this is where we start to see people clenching their glutes too hard, or too often, or both. Excessively thrusting their hips forward in an attempt to strengthen it. It's not making them better, it's making them weaker. So it leads into a gripping position, which is what you would see here. This is a terrible position. This is actually doing the same thing as this, all right, but it's with a strengthening method and not a stretching method. This is overextension of the where you see the same thing. All right, so again, this leads to hip gripping. It's a strategy you see all too often and leads to weaker glutes, not stronger glutes. All right, so what would I do about it? Well, there's lots of things, and won't go over all of that in this video. I want to use this video just to see understand what the hip is meant to do. But you can see other videos that I've done before with different hip mobility drills, different types of stretches, you know, quad stretches, stretching through the glutes and stuff as well. But again, I don't really have these are all useless if I don't do anything to stabilize and strengthen correctly. It's really, that's where the bigger differences are made, through stability and learning how to extend and get control of single leg stance especially. That's where I build a tremendous amount of strength through the glute. So in this quote here is a good one. So if people use their stability muscles to keep them stable instead of their global muscles, make a huge difference when it comes to injury prevention. All right, so so I'm not really too much of a fan of the hip thrust. It can be useful for some people. Not a big fan of the clamshell at times either. Much more effective these type of things where I'm like learning to get hip extension, possibly also where I start to combine the feet into things as well. Band distractions are really good. Again, you can search through my channel lists, have a look in the description below. I'll put some links there for you. There's tons of exercises you can do and need to do. And I'll put here this quote to stop thinking about things from like muscles of origin and insertion. Sort of think of how you move. So think of like things like this, like coming back to what we spoke about before with the different types of hip extensions and things like that. Try and think how you're really meant to move and use exercises that strengthen those positions, and then you'll get a better result. So this is where I start to use exercises like these that are more integrated, where I'm using the hip, the posterior sling, getting foot stability and hip stability, so stabilizing, more strengthening, getting an anterior. This is where I start to get that sprinting feeling where I've got to push over the big toe. So a lot more glute in this one, a lot more feet in this one. This one, again, another different type of propulsion type thing where I'm in extension and trying to learn how to control it. All right, so these things make a huge difference in the strength and the function of the hip, and bring in rotation, so you start to control things a lot more. All right, so in summary, hip needs to be mobile but also very stable. Has a huge influence over the lumbar spine and also over the knee. Restricted range of motion can be just as problematic as too much range of motion. You can't ignore the feet because they're playing a massive job in what's going on at the hip. Glutes are very, very prone to weakness and inhibition, so meaning that their work is stolen from them from the hip flexion type of muscles. So you have to use a combination of mobilizing and strengthening to ensure the function of the hip is optimal. And you're going to need more than just one or two exercises. You really need a series of lots of exercises to effectively strengthen the glutes, to hit it from different angles and different, as you can see, just hip extension itself has two versions of hip extension. So you can't just do one of them and think job's done. You've got to have something for all of those different motions of the hip that I showed earlier in the video. If you do that, then you're going to be a lot better at trying to control everything the hip can do. All right, so have any questions or comments, chuck them in under below. Check out the description. I've got like links to online programs that can help you. Yeah, and anyway, I hope you find this video useful of understanding all the different movements that the hip can make and how vulnerable it can be if you don't look after it. All right, thanks for your time. I'll see you on the next video.